Hello everybody and welcome to the Thursday edition of Video Clips. The first thing I want to talk about is so interesting to me anyway. More people are interested in eating healthier foods. I always like to hear that. More restaurants are offering plant-based options. That has truly been a blessing. The choices are also becoming more interesting. I remember when a dinner salad was about the only thing that was on the menu for me to eat. And I remember many times back in the days, like 24 years ago, when I would eat dinner before I went to meet friends for dinner because I knew I was pretty much going to starve. Well, some restaurants now are so interested in catering to people like me that they have a vegetarian or healthier section with a list of plant-based options, and it makes it easier to find better choices. But research actually shows that this may not be the best way to promote healthier eating. So in order to determine how menu layout influenced what types of dishes people would order, researchers randomized the participants in their study to 4 menu formats. So one was considered control. Everything was just listed on the menu, not pointing anything out, no sequestering of healthier options in a different place. Then they had the recommendation format, where the chef actually recommended the plant-based meal and said, you know, it's the chef's favorite. Then they had descriptive, where the descriptions were deliberately more appealing about the vegetarian food. And then they had vegetarian, which meant that the vegetarian dishes were placed in a special section. So you've probably seen menus like this. We have the menu, and then we have the children's menu, and then we have the vegetarian menu. Okay, so those were the 4 options. And then there were a variety of different participants, but the types that they wanted to pay attention to were infrequent vegetarians who said they very rarely ordered plant foods, and then frequent vegetarians who said that they were eating only vegetarian foods on at least 2 days, 2 entire days worth of vegetarian eating in the previous week. How the subjects ordered depended upon their eating patterns. So the infrequent vegetarians who rarely ordered plant food were more inclined to order healthier dishes when they were labeled either as the chef's recommendation or when the menu items were accompanied by really, really appealing descriptive terms. Surprisingly, the reverse was true for the frequent vegetarians. These menu formats made them much less likely to order plant-based meals. The frequent vegetarians were also less likely to order a vegetarian dish when the menu included a separate section for vegetarian foods. Well, what would possibly cause a group of people with a stated preference for vegetarian dishes not to order them when the restaurant appears to be catering to their eating habits? The researchers claim that it's something called moral licensing, which refers to the feeling of entitlement that people sometimes have after making some good choices. The special treatment of vegetarian dishes on a menu reminds the person who frequently eats healthier meals that he's done so, and motivates the choice of a less healthy option as a reward for prior good behavior. In response, the authors suggest that restaurant owners should experiment to determine which menu design is the most effective for a specific clientele. And by the way, this moral licensing also goes on in other areas like exercise, where people will say, well, now that I'm exercising, I can have dessert every day. Or I've been running, so I can have more food at every meal, or it's okay to have the French fries. So this is not an unheard of thing. Well, I have a different take on this study, which I think highlights a couple of different issues that are worth talking about. One is that many people are eating more plant-based foods because they know, in a general sense, that they're healthier. But these choices really aren't part of a comprehensive dietary plan for optimal health that includes a good understanding of how dietary patterns affect health status and outcomes. I mean, I've observed this with friends of mine who are obese and medicated, who will sometimes order a vegetarian dish because it looks interesting or because they're dining with me, like it's some kind of act of solidarity. Oh yeah, I'll have the veggie burger since Pam's having it too. There's a lot of buzz about plant food, but I don't see enough traction, or as much as I'd like to see, in shifting the population to an overall better eating pattern. I think it's sort of like a fashionable thing to eat something vegan once in a while. The other issue is that as long as plant foods are relegated to a different section of the menu, the idea that eating plant-based meals is not normal will be reinforced. The more mainstream, healthier dishes and choices appear to be, the more people will see eating plant foods as a normal choice. I've noticed a trend in this direction. I think it's really good. Many restaurants just list the vegetarian choices along with everything else. I mean, there are salads and appetizers and soups and main dishes and desserts, and everything is just all together. And I think that's good. It's all food. And then grocery stores are doing this too. There's a Kroger store near my house and also my summer place in Fort Clinton. And both of those stores, instead of having a health food section, they've taken all the stuff from those sections and they've integrated those things into the whole store. And I have to believe that more people are buying those healthier foods because they don't have to go to a special section of the store for health nuts like me. You know, they're just seeing this as they're doing their normal trek through the supermarket. They're happening upon these items, which are really, really good and often more delicious than the unhealthy counterpart. So I think that's all a good thing. One other thing I'll make a comment about in terms of restaurant trends. People will sometimes complain about cities like Columbus, and I would say it's true in more cities than not, that don't have a lot of vegan restaurants. But I would much rather see restaurant situations the way that they are in Columbus, which is we have a couple of really good vegan restaurants. All the rest of the restaurants, for the most part, will make dishes. They either feature entrees or they will make dishes for people like me. And the reason why I think that's better is I can go anywhere with my family and or friends that they want to go, and I can eat well. And that is so much easier than trying to talk my family and friends, who are notoriously carnivorous, except for my father and a handful of friends, notoriously carnivorous, and trying to get those people to go to the vegan restaurant with me. So I like this idea of all this stuff becoming more mainstream, and I think I would love to see the new normal become eating more plant-based meals, not that we need a special section in the menu or a special section of the grocery store. So anyway, that's my comment on this whole thing. But let's move on to something else. So I got an email or a message on where you guys are allowed to leave comments on from a person saying, why don't you do something on fibrocystic breasts? So I just want you to know I listened to these comments, and here you go. I prepared a very long paper with 19 references on fibrocystic breasts, and I'll tell you what I know about it. More than half of all women develop fibrocystic breasts during their lifetime. And in fact, the condition is so common that it's been advised that we should stop calling it fibrocystic breast disease and just call it fibrocystic breasts or fibrocystic breast conditions. This is appropriate because the condition really isn't a disease, but rather simply changes to the breast tissue, which include breast lumps or areas where the tissue has thickened. Other changes include fluid-filled round or oval sacs, scar-like fibrous tissue, hyperplasia, and the milk ducts or lobules, and enlarged lobules. The condition is most often experienced by younger women. You don't see too many postmenopausal women developing it. Many women have fibrocystic breasts and they're not even aware because they don't have any symptoms, whereas on the other hand, some women experience extreme symptoms that include swelling and breast soreness, tenderness, and sometimes extreme pain. The condition often changes throughout the menstrual cycle, which means that abnormal hormone levels, particularly high estrogen, is a likely cause. Research supports this idea since women often report breast pain as a side effect of estrogen or combined hormone therapy. Diet is a major contributor to both hormone levels and the development of fibrocystic breast disease, or condition. I almost caught myself going the other direction there because we called it that for so long. Cow's milk contains both estrogen and estrogen metabolites, and consuming cow's milk products results in higher circulating estrogen levels. Higher dietary fat intake, particularly saturated fat, increases the risk, and a combination of eating a higher fat diet along with lower fiber intake increases the risk even more. Other risk factors for fibrocystic breasts include having PMS, stress, and smoking. Some studies show that coffee, tea, or a combination increase the risk, while other studies don't. I don't think there's a clear answer to this, although when I get to what to do about it, there are some studies that clearly show some women benefit from eliminating caffeine. In response to finding fibrocystic lumps during a breast exam, a doctor will typically order either a mammogram or an ultrasound. Ultrasound is slightly better for differentiating cysts from more serious growths for younger women who have dense breasts. Once cysts are identified, sometimes fine needle aspiration is performed to remove fluid from the cysts and relieve the discomfort. Most of the time, those cysts will fill with fluid again in the absence of doing anything differently, so it's a pretty temporary solution. Some doctors will refer women to a breast surgeon for biopsy, even when the mammogram or ultrasound are normal, but this should be carefully considered since having fibrocystic breasts does not increase the risk of breast cancer for most women. However, women who have fibrocystic breasts and also show proliferative changes and have a higher risk of developing breast cancer than women who don't show such changes, particularly if they have a family history of breast cancer. So my comment about this is that if you are referred to a breast surgeon, I think some careful consideration should be given to whether or not you really fit the risk profile for having a biopsy, or if you're a person who's not likely to develop breast cancer. Over-the-counter pain medications and NSAIDs are often recommended, and oral contraceptives are often prescribed to regulate hormone levels. Medications only address the symptoms and not the underlying causes, and in fact a review of all the PubMed articles published during one 14-year period of time reported that pharmacological and hormone treatment can cause serious side effects, and that such treatment should only be used when lifestyle changes don't work. So I mentioned caffeine before. Eliminating caffeine has been shown to result in resolution of both structural characteristics and symptoms of fibrocystic breasts. One study showed that complete abstinence from caffeine resulted in complete resolution of the condition in 82.5% of women and significant improvement in 15%, for a total of 97.5% of women getting better who had fibrocystic breasts. Since diet and estrogen levels are causes, dietary changes, particularly those that lower estrogen levels, are advisable. Adopting a lower fat diet and higher fiber diet decreases estrogen levels. Within 6 months of dietary change, both pain and swelling in the breast was significantly reduced in most women when fat intake was reduced to 15% of calories and consumption of complex carbohydrate, plant foods, was increased. One study showed that women eating a vegetarian diet lower in fat and higher in fiber excreted 3 times more estrogen in their feces and had 15 to 20% lower plasma estradiol levels than women eating a westernized diet higher in fat and lower in fiber. A review of dietary intervention studies concluded that low-fat diets in general will reduce plasma estrogen levels. A case control study of women in Shanghai with fibrocystic breasts showed that a diet including more fruits and vegetables reduced the risk of proliferative and atypical lesions, which can reduce the risk of developing breast cancer. Another study showed that eating more fruit, vegetables, and legumes lowered the risk of developing breast cancer in women both with and without proliferative changes in the breasts. The authors stated that the effect was likely due to a number of things, and their list included antioxidants in fruits and vegetables, which can reduce DNA damage, phytochemicals in plant foods that contain enzymes that can inactivate and detoxify carcinogens, substances in plant foods that lower circulating levels of steroid sex hormones and facilitate excretion, and affecting the activity of enzymes that reduce the activity of sex hormones. In other words, multiple mechanisms of action. Fibrocystic breasts are principally caused by higher estrogen levels and dietary patterns that contribute to higher estrogen levels. While the condition doesn't always lead to breast cancer, the habits that contribute to it do. Drugs and oral contraceptives can control pain and hormone levels and symptoms, but they have side effects and should be avoided if at all possible. The best approach for both lowering estrogen levels, resolving fibrocystic breast diseases and related conditions, and reducing your risk of breast cancer is to adopt a low-fat, high-fiber, plant-based diet. So I hope that answers your question, the person who wrote to me about this, about fibrocystic breast conditions. So that's all for today and all for the week, in fact. So as usual, pass this on to anybody who you think would enjoy watching it, and I'll be back to you next week with more news.